So there's a lot of things that guys kind of do wrong before they start seeing a qualified physician for testosterone replacement. The main one is where they're getting their testosterone from. A lot of guys are sourcing it from the internet, maybe getting it from an overseas pharmacy, maybe getting it from a guy that they know at the gym. Risk factors there is they don't know what they're putting into their body. They might not be getting quality testosterone, if they're even getting testosterone at all, and they might be injecting dangerous levels. So the next mistake is that they don't have anybody monitoring what's happening to their bodies, and specifically their hormone levels once they start to inject. So they don't know what testosterone level they're at. They don't know what's happening to their estrogen or their PSA. And so they're inviting a lot of risk factors and side effects as serious as heart attack and stroke. So there's a lot of things that they want to watch out for that a trained physician is going to know how to handle whenever they see that come up in the office. Another thing is that they think they have to cycle because that's what their buddy at the gym does. When you're cycling on and off of testosterone, the problem is that you start to confuse your body. Your body doesn't know if it's supposed to be producing testosterone or if you're going to put it in next week or how that's supposed to happen. So once you intervene in that cycle a lot, then you can get to a point where your body stops being able to produce as much testosterone as it should have been able to. So we see that a lot with guys in the clinic when they come in after they've been treating themselves for a long time. A lot of these guys are pretty young and they mess with the testosterone early, either through steroids or pro hormones they got from the supplement store. And then now their body, even in their 30s, is not able to produce the levels that it should be able to. And then the other thing is not using any medications to control side effects. For example, we use an estrogen blocker in our clinic to make sure that once we inject that testosterone, the patient's body doesn't convert it to estrogen and cause side effects. We also use a hormone called HCG that helps them continue to produce some of their own testosterone in case they ever have to quit for any reason. It will be quicker for their body to start making testosterone again. It also prevents side effects where they are going on and off, where they're not producing testosterone for years and then they suddenly have to produce it. The other thing that it prevents is that complete lack of production from their body. So when we inject testosterone in our clinic, we're stacking it on top of what they're already making because of the HCG.